Attention Deficit Hyperactivity Disorder, or ADHD, is a neurological disorder that makes it difficult for people to pay attention and control impulsive behaviors. The Centers for Disease Control and Prevention reports that about 9.4% of children in the United States have been diagnosed with ADHD. According to Healthline, the average age of ADHD diagnosis is 7 years old. ADHD can seriously affect a child's self-esteem, their performance at school, and their relationships with family and friends. Neurofeedback therapy is an emerging, non-invasive treatment for ADHD and helps strengthen brainwave patterns associated with focus and concentration. Brain activity is monitored using EEG, and the training protocol targets the ratio of theta to beta brainwaves. Lowering theta and raising beta brainwaves has been shown to reduce and even eliminate the classic behaviors associated with ADHD. Mandala Ball is a VR game designed as a therapeutic resource that utilizes the concept of mind over matter to create an empowering tool for children with ADHD to learn how to control their condition. The game will train the player to increase their concentration levels via the act of telekinesis. It allows players to move objects around solely with the power of their mind. A patient's brainwaves are monitored using the MindWave headband, which records the EEG signals via open-source software. We use hand tracking as our primary input method, which offers a more delightful and realistic interaction and increases immersion levels for the patient. In the game, the Mandala Ball is a companion that accompanies a child throughout the experience. The Mandala Ball speaks to the player, providing instructions and social interaction, and becomes the primary point of focus for the patient. The patient is given a series of short, selective tasks to increase their attention levels to 60%. When the attention levels are in this range, the patient will be asked to move objects around the room. The time and difficulty level to complete each task is saved for analysis. Difficulty increases over time based on the collected brainwaves from the MindWave headset. As the level of difficulty increases, more distractions will appear, forcing the player to increase their level of concentration. Game mechanics are also varied throughout the experience. Multiple VR environments allow for a variety of training scenarios, and by completing the various telekinesis-themed activities, our players will gain the confidence to control their ADHD condition in the real world. The data generated from the gameplay is combined with the brainwave data and is processed and visualized as a standard report for therapists and an easy-to-follow progress report for parents. Aside from ADHD, our neurofeedback game can be adapted for a variety of other neurological disorders, including dyslexia, anxiety and depression, post-traumatic stress disorder, and autism and Asperger's syndrome. In the near future, however, our goal is to publish our findings about how our VR game and neurofeedback in general can help improve the attention level of ADHD patients.